Hi, this is Jason Lang. I'm a orthopedic surgeon, joint replacement specialist in Asheville, North Carolina with Emerge Ortho. And I wanted to take a minute to demonstrate some knee exercises for my post-operative knee replacement patients to emphasize both extension as well as flexion on their range of motion, really looking at exercises that you can be doing at home on the days you're not going to see your physical therapist. These are what we call, for the most part, with the flexion, closed chain exercises, which means your foot is on the floor or on a step. So once your therapist has gotten you bending to the point where you're at 90 degrees and we've seen you in clinic and taken your stitches out, you can really start to work more and more of these exercises in to maximize what your ultimate range of motion will be. So I'll just demonstrate a few of them on this video and you can practice them at home. So the first one I'll show you is one where you can be working on this when your knee is not even yet at 90 degrees of flexion. So you can put your foot up on a step stool, or if you've got a step in your house, put your foot up flat on the step, and then you can lean into your knee to the point where you start to feel some discomfort. Lean into that, holding on to something, and hold that for a 10 count. And then once you've gotten to 10, you can come back up out of that stance, recover from it for another 10 or 15 seconds, and then again, lean back into the knee. So these exercises are not utilizing anything other than your body weight to lean into the knee and to stretch out those tissues and to work on stretching out that scar tissue. So this is just body weight leaning into it. This is not standing up, and some of the exercises you'll do with your therapist where you're using a towel or your active muscles to pull the knee back. These are different in concept. Again, using your body weight, leaning into the knee to try to get that tissue to stretch out. Another similar exercise, if you have a rocking chair or a rolling stool at home, is the same sort of concept. If this is my operative knee, I'm sitting in the rolling stool and I'm using my body weight to just rock into that operative knee, just to try to get it to gently bend. Just kind of have the mental image of rocking your way into that scar tissue and then rolling back out, rocking into it, rolling back out, just trying to gently work your way into that scar tissue, stretching it out gradually and slowly. Again, these exercises can be done very soon after the operation. Once the incision is healed and we've gotten your stitches out, you can start working on these and start to maximize what that range of motion will be. Your therapist will have you in a setting like this, working on machines and using other equipment to really try to bend that. But these are demonstrations of exercises you can be doing at home on the days in between to try to, again, every day work on stretching out that muscle, working against the scar tissue, and really try to have an optimal outcome. So those are the flexion exercises. The last thing I'll show you is just don't forget about knee extension. That's the straightening of your knee. And those, you need to just spend some time with the knee propped up. It's not going to want to come out into full extension, but just having it with nothing behind the knee, sort of a suspension bridge with nothing behind the knee, and just working on just gently letting it relax, stretching out your hamstrings, pushing down really gently on it, and just having that knee come gradually over time out to full extension. Having your knee be able to come fully out straight is going to really help with your walking afterwards, so that you have a nice normal gait after you've done the knee replacement, so that you can start doing those things that you like doing. So again, the flexion exercises are important. Don't forget about the extension or the straightening exercises as well, and just work on those. Again, every day you should be doing a little bit of exercise, a little bit of straightening every day, whether you go to physical therapy to their facility or not. You should be working on those at home every single day. Well, I hope everything's going well otherwise with your recovery. If you have any questions, please do call the office. Myself or my team's available to answer questions and talk you through this process. Good luck with everything, and we'll see you soon.